Parkinson's disease is a neurodegenerative disorder that affects dopamine-producing neurons, decreasing the amount of dopamine in the substantia nigra. The substantia nigra is a basal ganglia structure located in the midbrain that helps control muscle movement in the body. This brain scan shows the comparison between a normal human brain and the brain of someone who has Parkinson's disease. The redness in the scan represents dopamine levels in the substantia nigra structure. In the normal brain on the left, you can see more red color compared to the brain on the right. This shows the lack of dopaminergic cells in the brain of someone with Parkinson's disease. This picture shows two different substantia nigra structures, one being from a normal human brain and the other from the brain of someone with Parkinson's disease. The normal structure on the left has a higher number of dark pigmented dopamine cells when compared to the diseased brain on the right, showing another example of the difference in dopamine levels in the brain. Parkinson's incidence is known to increase with age, so most patients are over the age of 50, with the exception of 4% who are diagnosed earlier in life. The Parkinson's Foundation has found that by the year 2020, more than 1 million people in the United States and 10 million people worldwide will be living with Parkinson's disease. Although the exact cause of Parkinson's disease is unknown, it is believed that the condition is caused by a combination of genetic and environmental factors. Environmental risk factors include chemical exposure, making those with welding, farming, military, and industrial professions more susceptible to Parkinson's disease. Multiple studies dating back to the 1990s have found that exposure to various pesticides increases the risk of developing Parkinson's disease because they target the dopaminergic system. In the map shown of the United States, we see that the more rural areas have higher numbers of people living with Parkinson's disease due to chemical exposure from pesticides used in farming. Every Parkinson's patient shows different symptoms, but doctors mainly look for bradykinesia, tremor, and rigidity to make a diagnosis. Bradykinesia is slowness in movement that is believed to result from failure of basal ganglia output to reinforce the cortical mechanisms that prepare and execute the commands to move your muscles. This decrease in muscle movement causes rigidity or a stiffness in muscles, bringing Parkinson's patients discomfort and pain, while the cause of tremor remains unknown. There is currently no cure for Parkinson's disease, but there are treatment options available to patients depending on their symptoms. We know that this condition is caused by a lack of dopamine in the substantia nigra, but patients cannot simply take dopamine because it cannot enter the brain due to the strong blood-brain barrier. However, patients can take dopaminergic medication to reduce rigidity, improve speed, help with coordination, and lessen tremor. The most common medication taken by patients is a combination of carbidopa and levodopa. Levodopa is a central nervous system agent that is absorbed by nerve cells in the brain and turned into dopamine, increasing the amount of dopamine in the brain to relieve symptoms of Parkinson's disease. This is taken with a decarboxylase inhibitor called carbidopa to prevent levodopa from being broken down before reaching the brain.